This is the Thought Leaders podcast series, an extension of the Human Connections Generator event. Brought to you by ELA, the Early Learning and Literacy Alliance of Waterloo Region.
Hello, I'm Fauzia Baig, the Director of Equity, Diversity and Inclusion for the region of Waterloo, and your host for this episode of the Thought Leaders podcast. I'm thrilled to introduce the second episode of the series entitled Learning, Doing, Being. Human Connection Sessions begins with a conversation between a world-renowned expert and Dr. Jean Clinton, child psychiatrist, author, advocate, and ELA advisor. This podcast episode flows out of Dr. Clinton's conversation with one of the world's most preeminent neuroscientists, Dr. Adele Diamond. Dr. Diamond is a Tier 1 Canada Research Chair in Developmental Cognitive Neuroscience. She is based out of UBC. Dr. Diamond is an expert in executive function, what it is, and how it develops over the first 20 years of life. Here are a few highlights from her conversation with Dr. Clinton.
Prefrontal cortex, which executive functions depend on primarily, is the most vulnerable area of the brain. So if you're sad, stressed, lonely, not physically fit, executive functions are going to take the biggest hit and the first hit. I think stress is different than arousal. It's different than the excitement of being challenged. It's different than the thrill of a challenge. It's anxiety, it's fear, it's worry. That I don't think is helpful, at least not for executive functions. Communication is huge, and listening to the child. We spend so much time talking and so much time wanting to problem solve. We need to listen and let the child do the problem solving and let the child feel heard.
I think that, all of us know how stress can impact us over time, but I don't think we actually reflect on how much it can affect us on our day-to-day lives and the things that we do and in our conversations and how we see other people, really, how we read other people or understand other people, and how we have, in our minds, space for actually being able to listen and read situations. And I think that part of Dr. Diamond's talk really, again, reminded me of the importance of, for me at least, understanding where I'm at with my stress and really giving it really a lot of importance in terms of, I can't be entering into challenging conversations when I'm in a state of stress, right? And so when I think a lot about what she said, it just really reinforces how much we underestimate the impact of stress as adults, and especially in children. After the conversation with Dr. Diamond, Dr. Clinton spoke with Dr. Mekalai Kumanan, family physician at Two Rivers Family Health Center and Chief of Medicine at Cambridge Memorial Hospital, and Ana Luz Martinez, the Settlement Program Manager for the Kitchener-Waterloo Multicultural Center. Dr. Clinton started by asking them how Dr. Diamond's talk resonated with them and their work. Dr. Kumanan started us off.
I was really struck by the relationship piece and just how important those relationships are. So as a family physician, we pay so much attention to the relationships we develop with our patients. And we know that when a patient has a compassionate provider, it really can have an impact on their health outcomes and their willingness to follow through on recommended treatments. And so we really try to weave that into everything we do in medicine. And certainly as a parent, I really value that perspective. I think the other piece for me is really just thinking about some of the really simple strategies that she recommended that we could consider.
Ana Luz, you're a settlement program manager at the KW Multicultural Center. What resonated?
Working with newcomer and being as a newcomer as well. One of the things is the stress. No, she emphasizes a lot of the stress that I think we are dealing more. I mean, as a family, as children, with all the issues that the world is in now. We are talking about climate change and COVID and all things that the children are listening, and how the stress will affect them, no? And how, as Dr. Kumanan has said, how we can support the children and the families with some probably small things, but how we can, for me, how we could do some education in that area that we can support parents. I mean, as a settlement worker, I think that will be so important, knowing that not all newcomers will come with trauma, but I think a number of them will come with trauma. But I'm just thinking as well, just the stress or immigrate to another country, what are the consequences on children on that one?
Yeah, so that that profound impact on stress, and I found it, I found it fascinating her separating out anxiety and stress,
Mhm.
and I can only imagine. Well, I actually don't have to just imagine, because as an immigrant myself, I came to Canada when I was 11, and the stress of fitting in, the not knowing the rules, not knowing how people dressed, and that absolutely affected me for a very long time. And coming from, my mom and dad came with a family of 6 kids, if you can imagine, and so the stress that my mom experienced actually also affected how much she was going to be
Mhm.
available to help us. So I think the services that you offer, Ana Luz Martinez, must be just amazing for families to address their stress. Dr. Mekalai, the other thing that struck me about what Adele was talking about was a lot of kids are going to look like they have ADHD,
Mhm.
when in fact, there might be something else going on. And I just wonder what's the practice in the field just now. What do you think? Do you think people are becoming more informed about stress and trauma and the impact on the brain, or are we still at the old checklist? And
Yeah, it's a great question, Jean. I think that perspective of really needing to understand the context of a child's symptoms is so important. Sometimes our patient may come to us with the checklist completed. Sometimes that's what actually initiates the appointment. But I think it's really on us to really look more broadly and try to understand the context in which the patient or the child is having symptoms. I think the benefit of family practice is that we often will know other family members or the entire family. And so sometimes, we don't need to delve into that too much, but we already have that information. In terms of awareness, certainly I'm seeing quite an increase, at least I can say anecdotally, in people coming to us with concerns about distractibility or difficulty focusing, memory issues, that sort of thing. And I've seen that really throughout the pandemic. And so I'm hoping that this pandemic, as much as it's been very, very stressful, I hope it helps us to increase awareness of the impact of stress on us as individuals in terms of our mental health and physical health. So I think it's a really a good time for us to relook at how we approach these situations.
Yeah, I think it's one of the as a settlement workers, we have observed as well that the misdiagnosis as well of children, because they could have those stress or trauma, and then they are behaving as was explaining, that the behavior is not because they have some problem, it's just because they have some issues that had not been really discussed about it. And we have seen a number of children being diagnosed with that one. Sometimes it's just the language issue, they are in the process of learning the language, and this is sometimes they are quiet. They don't answer to the question that the teacher could have, or just no focus. Not because I think also the parents, as you mentioned, Dr. Clinton, is that parents as well, they are dealing with their own process of adjusting to the new country. they are not present for the children as well. No, they even though that they want to support them, but they are also in their own journey to adjust to the new country. That I think that's so important. And the other thing that you also mentioned is that the checklist that the doctors have, that we have seen that is not, at least in Kitchener-Waterloo, I have observed that some doctors don't take the time to really talk with the families. They just see the individual for 5 minutes and then they just dismiss them. And I think that's very important. That there is more time being spent by the family doctor or who is taking care of the family that will provide some holistic approach of the health. Because I think, in my opinion, that is missing. I mean, from my own experience as well, I did have a child that has some health issues when he was small, and we were not able to find that connection with the health system. But yeah, I hope that will improve. I hope that also the schools of medicine will change also the way that they are teaching, because I feel that now is more very individualistic and very focused on one thing, but not the whole environmental effect. The child in this case, but the whole family as well.
Yeah, I think a lot of work is being done in medical schools and in family practice. You know, I happen to have a bunch of kids who have had lacked imagination and had followed their mum and dad in being physicians, and so particularly at McMaster Medical School where I went and my kids went. The focus on thinking about the whole child is very important. But you know, I think what I also understand is two of my daughters are family doctors, is the pressure, the
That's
stress
right.
that primary care is under just now is absolutely affecting the executive functioning of doctors. And you know, we don't necessarily have a system that is saying we're going to look after you. Instead, we're pressuring and seeing burnout. But you know, I wonder, Dr. Kumanan, of you, what do you think about executive functioning and family docs at this stage of COVID pandemic 20 months in?
That's the burning question, I think, right? Yeah, I mean, definitely we know that burnout rates are very, very high amongst healthcare providers at this stage of the pandemic. And, you know, I think there's there are a lot of resources available to us. There's a lot of work around resiliency, but ultimately, I think there are some system changes that are required. You know, as much as we work to try to integrate our healthcare system, that doesn't always happen. It can be very choppy. You know, I'm fortunate enough to work in a family health team, so I have a very strong team of allied health that I work closely with. And we are then able to support patients together and communicate with each other and with our patients. That doesn't happen everywhere. And, you know, a lot of healthcare providers don't have access to that. And then as a result, a lot of patients don't. So I think there are some system pieces that I really hope that we can you know, learn from during the pandemic, and then continue to work towards improving as we work our way out of it. It's definitely it can be an issue.
I wonder, thinking about community activism. You know, so thinking about this event as generating action within the community. I'm wondering, from your different perspectives and your different roles, how do you see you can contribute, or your field can contribute to relationships taking more prominence in the community? Do you have thoughts on that?
I think family physicians are really well positioned to work with parents when we're thinking about young kids. And, you know, as much as we are busy and our appointment times are quite short, I think what's really lovely about Dr. Diamond's learning and messaging is that some of these strategies are really simple and straightforward, and are things that we can all start doing tomorrow or today, in fact. You know, when I was looking at some of the work that she's done, I was reflecting on it, and my son came home from school yesterday and it told me he was really disappointed in himself because he didn't think he did as well as he could have on a math test. And my initial instinct was to say to him, well, where'd you go wrong? Let's look at those and we'll work on that. And I caught myself after listening to some of Dr. Diamond's work. And I said to him, I love you and I really care about you. And I'm sorry if you're feeling disappointed about your mark, but I will love you no matter what mark you get on your math test. And we can talk about that. And it really just struck me how quickly his demeanor changed and how quickly his perception of how he performed changed. So, and that was with, very little intervention on my part, if we want to call it that. So I think there's so much that we can do in the healthcare system to work with parents and families, to really give simple strategies. Often when people look to healthcare, I think we're looking for really complicated solutions, but I think I would go back to the simplicity of this and how quickly we are able to make those connections with others and how impactful those connections can be.
You're listening to the Thought Leaders Podcast featuring Dr. Jean Clinton in conversation with Dr. Mekalai Kumanan, a family physician at Two Rivers Family Health Team and Chief of Medicine at Cambridge Memorial Hospital, and Ana Luz Martinez, the Settlement Program Manager for the Kitchener-Waterloo Multicultural Center. This podcast is an extension of the Human Connections Generator event, brought to you by Ella. We rejoin the conversation as Ana Luz speaks appropriately enough about the importance of listening.
I think settlement workers is they have that relationship with people who come to see them. But I think what is for me very important is that the listening part, how important is to be there for when the person is with you, not really, as I said before, is just be present and with an active listening. Now that, as was said, is that sometimes people just want to talk about what is happening in everyday life, and then they will be able to solve their own problems. And just was listening as well that we work in partnership with the library, with Kitchener Library and Waterloo Library. And one of important thing is that having those resources there, that we can encourage the parents to use those resources. Now there are reading clubs and talking about how important is the reading aspect. Is not just because of the reading, is the relationship that will establish with the parents or the persons who is reading the book at the library. I think that's some of the resources that is important for us to promote it. But as well, as me going back again, is the relationship with the settlement worker and the parent, in this case, that supporting the parent in the journey of being in Canada as well. I think there are simple things that can be done, and I would like to share that the conversation that we're having today with the team. But also, I would like to focus more as on education, how we can. I mean, simple things, but we need to promote how to do those simple things. The communication is so important. I mean, the language that we're using, the message that we're giving to the children, but we need to do how to do it as well. Huh?
Mm-hmm.
And even the community can provide those messages through radio, to television, the school itself.
Yeah, I love that idea. An awareness campaign, but with a very much focused on a how-to. One of the things that that struck me with listening again about Dr. Diamond is that you really need to have those core executive functions of impulse inhibition, working memory, and cognitive flexibility in order to become the kind of parent, the kind of educator that you want to be, so to the kind of support person you want to be, so that those reflective functionings that we long for to support families, so that, for example, I can imagine, Ana Luz, as you're talking, to help parents be able to put themselves in the shoes of their children, to understand the perspective, as Dan Siegel will talk about, the mind-mindedness. In order to get to that, be able to put yourself in the shoes, have that reflection, you absolutely need to have those core functions. And in order to have those core functions develop and then operate, you need to be reducing stress. And
That's right.
so it seems to me that a big direction we need to be thinking about is thinking through the lens, not of trauma. But it's important to think about trauma, but it's not all been experienced as trauma for people.
Mhm.
It sure as heck has been experienced as stress. And I wonder, in my medical training, and we've talked a little bit about this. I just wonder how much are you being trained as a settlement worker, and you as a primary care practitioner, Dr. Kumanan, are really encouraged to be reflective practitioners.
Yeah, I love that part because I'm just some of the things that we know that is we are not doing because of the pace. I mean, as doctors are saying, we have more and more and more things to do every day, and then we are not actually reflecting the way that we are doing. I mean, are we doing quantity or doing quality as well, or how we can combine them, because there are more in demand. As the city is growing and more people are coming, we need to serve more people. But the reflection part is so important for our self-care as well, but also the way that we can actually improve the way that we are providing the services and make sure that yeah, we are doing well. We are there for them, but not in a paternalistic way, because that's also very important. That we are there not just as a parent of the newcomer. We are there to facilitate the process, but they have the capacity to resolve their own problems. That we are not there to resolve the problems. That is quite important as well. And just I think by doing reflection is that we can see how the way that we are doing what approach we are doing as well, because it's easy, I think, when we dictate, okay, do this one, do this one, do this one. I mean, even for the children, then allow the person to have the information, or the child, and then make the decision based on that information, even that for us could be wrong.
Yeah, well, it is evolving cognitive flexibility, giving them those options. Yeah.
But reflection, I think, becoming so important. But as I said, is when I wrote here that time, or even for the parents, not for the parents, because there is one thing and the other and the other and the other. And when a parent, I'm talking about equity, when a parent needs to work 2 shifts because there is not, the income is not enough to pay what I need, then there is no the time to support the child. There's no time to reflect on how I'm doing as a parent as well.
Yeah, that pay the rent or feed the kids. And what are you talking about now? You want me to reflect? Come on. Yeah, very hard, very hard. But I guess the message from Adele is that through relationships, you're able to diminish that stress. And I imagine that people who come to your settlement services meet each other and form connections with others, which again is a stress neutralizer.
Yeah, and it's something that we have missed from COVID, no? That we have not been able to meet and see the effects, to meet the person in person, because everything has been online, is on the phone, and you don't have that relationship with the person. You don't see the body language. You don't see actually what the person is dealing with, because it's just, even you don't have sometimes the opportunity to see on the screen. It's just on the phone.
Wow, fascinating. Yeah. So Mekalai, what thoughts do you have on this?
I hope that the culture of medicine is shifting a little bit, where we are more able to recognize the impact of stress both on ourselves as well as how it can impact our patients.
Yeah, I completely agree with you that we are moving forward in the field, in the professions that we hold so dear to our hearts.
I think what really struck me is the impact of caring relationships. And as much as stress can have a negative impact on our cognitive function, there is a way for us to be resilient. And it seems to be a really simple and easy solution, and that really is nurturing, caring relationships. And I think for me, I really, am going to reflect on how many caring relationships do I have around me, and how many caring relationships can I make and nurture for my friends, my family, my community. And even thinking about, how can these caring relationships be more than just, or can they be more than just between people? Like I think about the impact of relationships between spirituality and faith and the environment and nature, and how all of these, may be considered caring relationships. And so for me, I think what really is most impactful is that there is a way for us to be resilient, and that really centers around connections and caring relationships. And all of us, I think, can do things to enable that and to grow it and nurture it.
You've been listening to the Thought Leaders Podcast, featuring Dr. Jean Clinton in conversation with Dr. Mekalai Kumanan, a family physician at Two Rivers Family Health Team and Chief of Medicine at Cambridge Memorial Hospital, and Ana Luz Martinez, the Settlement Program Manager for the Kitchener-Waterloo Multicultural Center. This podcast is an extension of the Human Connections Generator event, brought to you by Ella. Our host, Fauzia Baig, the Director of Equity, Diversity and Inclusion for the region of Waterloo, leaves us with a few final thoughts.
It was fascinating how often throughout the Generator event, talks evolved into discussion of how fundamentally important relationships are to us, as individuals, as families, as communities. Our ties to each other help us when we are struggling, helping us not only to grow, but thrive. It seems as a universal thread throughout all of these talks. I hope you enjoyed listening as much as I enjoyed hosting. Let's keep the conversation going.
Special thanks to the host for this episode, Fauzia Baig, from Waterloo Region. Also to neuroscientist Dr. Adele Diamond for sharing her unparalleled knowledge and expertise. Thank you as well to Dr. Mekalai Kumanan and Ana Luz Martinez for their knowledge, local insights, and wise reflection. As always, thank you to our friend and advisor, Dr. Jean Clinton. The Thought Leaders Podcast is part of Ella's Human Connection series, available wherever you get your podcasts.